Here is what nobody tells you. The 8 hours you spend unconscious every night are not neutral. They are not rest. For millions of adults over 60, those 8 hours are the most dangerous hours of the entire day. And the weapon causing the damage is not a disease. It is not a medication. It is not something your cardiologist flagged in your last blood panel. It is the position of your head. Right now, tonight, the exact angle your neck is resting at when you close your eyes. I know that sounds almost too simple to be terrifying, but stay with me, because the science behind what I am about to share stopped researchers cold when they first saw the data. Stroke risk does not peak when you are stressed at work. It does not peak after an argument or a hard workout. It peaks in the morning between 6 a.m. and noon with a 49% increase driven by something called a morning blood pressure surge. And what happens in the dark hours before that surge? What position your body is in, how your blood is flowing, whether your brain is actually clearing its waste or quietly drowning in it. That is what determines how dangerous that morning window becomes for you. In the next 20 minutes, I'm going to walk you through 6 sleeping mistakes, ranked from surprisingly harmful to genuinely life-threatening. Then I'm going to give you the 2 positions that sleep researchers, cardiologists, and neurologists actually recommend, and explain exactly why they work at the level of your blood vessels and brain tissue. This information is not in your doctor's pamphlet. It is not on the wall of your physician's office. And after today, you will never look at your pillow the same way again. Before we go any further, drop a comment right now. Tell me, are you a back sleeper, a side sleeper, or a stomach sleeper? Your answer is going to matter very soon. Keep watching. Before we get into the list, I need to give you a foundation, because without understanding the why, the mistakes I am about to describe will seem exaggerated. They are not. When you are in your 20s and 30s, your blood vessels are elastic. They stretch. They bend. They adapt. If you sleep in a twisted position, your cardiovascular system quietly compensates. You wake up with a sore neck, take a stretch, and move on with your day. No lasting damage. No consequence. But after 60, the biology shifts in ways that are slow, invisible, and cumulative. Your arterial walls begin to stiffen. The small vessels that feed your brain become less flexible. The pressure inside your skull becomes increasingly sensitive to changes in body position. And most critically, your blood pressure regulation system, the automatic mechanism that keeps everything balanced while you sleep, becomes slower to respond. There's a phenomenon called overnight blood pressure dipping. In healthy sleepers, blood pressure naturally drops 10 to 20% during sleep. This is protective. This is your body performing its most important cardiovascular maintenance. Blood vessels rest. Inflammation cools. Brain tissue recovers. But if your sleep position is wrong, if it is compressing the wrong vessels, restricting the wrong airways, or tilting your blood flow in the wrong direction, that protective dip gets disrupted. Your pressure stays elevated through the night. Your brain is working against resistance for hours while you believe you are resting. That is the framework. Hold on to it as we go through each mistake, because it is a thread connecting all 6. This one surprises people the most because it sounds like the right way to sleep. No pillow or just a very thin one. Body perfectly horizontal. Spine neutral. Mattress companies market this. Physiotherapy websites praise it. It sounds like ideal alignment. But there's a critical piece of the picture that nobody is showing you. When you lie completely flat, particularly after age 60, blood does not distribute the way it does in a younger body. In the absence of gravity assisting drainage, cerebrospinal fluid, the liquid that cushions your brain inside your skull, can begin to pool. Intracranial pressure edges upward. The tiny vessels inside your brain that are already managing decades of mild are now under more pressure than they should be, and they stay that way for 7, 8, sometimes 9 hours straight. A study published in the Journal of Clinical Sleep Medicine found that even modest head elevation, as little as 15 degrees, produced measurable improvements in intracranial pressure and nighttime blood flow dynamics. Now here is the symptom most people completely misread. You wake up at 3 in the morning with a dull, throbbing headache behind the eyes at the base of the skull. You think, this is just aging. Headaches happen. You drink some water, take an ibuprofen, and go back to sleep. What if that headache is not random? What if it is your brain's way of signaling that pressure inside your skull has been elevated for 5 straight hours, and your body has finally reached the threshold where it had to wake you up to say something? The fix is not complicated. A 15-degree elevation of your upper body, not a stack of pillows which creates a different problem entirely. And I will address that in mistake 3. I mean a gradual incline, a wedge pillow, or an adjustable bed raised slightly at the head. That one change, 15 degrees, can be the difference between a brain that is quietly stressed all night and one that is actually recovering. Here is one that surprises almost everyone I bring it up with. Stomach sleeping feels harmless. You are not putting pressure on your heart. You are not restricting your lungs. Or so it seems. You are just lying face down. A lot of people find it comfortable. Many have slept this way for decades. But here is the structural reality that changes everything. When you sleep on your stomach, you physically cannot breathe with your face pressed straight into a mattress. So you do the only thing you can do. You rotate your head to one side. And because humans are creatures of deep habit, it is almost always the same side, every night, for years. Now think about what that means for your anatomy. Your neck is rotated up to 90 degrees for 7, 8, sometimes 9 consecutive hours. And running along the sides of your cervical spine, the bones in your neck, are 2 arteries called the vertebral artery. These vessels carry blood directly to your brainstem, your cerebellum, and the regions of your brain responsible for balance, breathing regulation, and coordination. When your neck is rotated significantly to one side for prolonged periods, these arteries can become kinked. Picture stepping on a garden hose. The flow does not stop, but it becomes restricted, and restricted blood flow to your brainstem for 8 hours, night after night, year after year, is not something your body simply absorbs without consequence. Research published in the Journal of Manipulative and Physiological Therapeutics confirmed that extreme cervical rotation measurably reduces vertebral artery blood flow velocity. The study was originally focused on chiropractic manipulation, but the anatomical principle applies directly to sustained sleep positions. There is also a second problem with stomach sleeping that affects your breathing. Your rib cage is pressed against the mattress. Every breath you take all night is a breath fighting against compression. Your diaphragm cannot fully descend. You never reach what is called full tidal volume, the deepest, most oxygen-rich breath your lungs are capable of producing. Lower oxygen per breath, restricted arterial flow, both happening at the same time. For a 35-year-old, the body compensates. For a 68-year-old managing any degree of hypertension, cardiovascular history, or reduced arterial flexibility, this is a slow, silent, cumulative problem building in the dark. If you typed stomach sleeper in the comments earlier, this one was specifically for you. I want to stay in the neck region for a moment because the next mistake is one people make with genuinely good intentions, and it creates a very similar danger through a completely different mechanism. Stacking pillows. 2, 3, sometimes 4 of them, all underneath the head. People do this for a real reason: acid reflux, sinus drainage, breathing difficulties, snoring. A small amount of elevation does help with some of these. I am not dismissing that. But here is what happens when that elevation becomes excessive. Your head gets pushed forward significantly. Your chin tilts toward your chest. And that forward bend of the neck, what clinicians call cervical flexion, compresses the same vertebral arteries we just discussed, but this time from front. And there's a third vessel that almost never gets mentioned in this conversation: the internal jugular vein. This is your brain's primary drainage pathway. It carries deoxygenated blood back down from your brain toward your heart. When your neck is bent forward excessively, the jugular drainage pathway becomes partially obstructed. Blood drains less efficiently. Pressure inside the skull builds slowly and quietly. And the brain's ability to clear metabolic waste during sleep, which I will explain in detail when we get to the recommended positions, becomes significantly compromised. You may recognize the morning after symptom of this problem: brain fog, a heaviness behind the eyes, that deeply frustrating feeling of waking up from 8 full hours of sleep and still feeling like you could go right back to bed. You are not lazy. Your brain may have literally been underdrained all night. The correction is not complicated. One pillow, one properly contoured pillow, ideally a memory foam cervical pillow, designed to support the natural curve of your neck without forcing your head into an angle. Dozens of patients I have worked with reported their morning headaches disappeared within a single week of making this one change. One pillow. That is the entire intervention. How many are you using right now? Drop the number in the comments. I genuinely want to know how widespread this habit is. Now, we are entering territory that is going to genuinely surprise a lot of you. Side sleeping in general is considered one of the better positions, and for most people it is. but the direction you face matters more than almost anyone realizes. And this is especially true if you're managing any degree of cardiovascular history, high blood pressure, or reduced heart function. Here is the anatomy. Your heart sits slightly left of center in your chest. It has a natural orientation, a natural geometry. It is built to rest in. When you lie on your right side, gravity pulls your heart slightly away from that optimal resting position. But more importantly, your body weight compresses the right side of your torso, and running directly through that region is the inferior vena cava, one of the body's largest veins. The inferior vena cava has one job: return blood from everything below your waist, your legs, your abdomen, your digestive organs, back up to your heart. When you compress that vein by lying on the right side, that return flow becomes restricted. Your heart has to work against reduced preload, which means it is pulling harder than it should just to fill each chamber properly with every single beat. For a healthy person in their 40s, this is easily compensated. But for someone over 60 managing borderline heart function, mild heart failure, or chronic high blood pressure, your heart is already operating close to its ceiling. Adding unnecessary nightly resistance is like running a car engine 10% harder every single night for years on end. The cumulative mechanical, where is real? The European Journal of Heart Failure published findings showing that patients with heart failure naturally and instinctively avoided right-sided sleeping. Their bodies had detected the discomfort before their conscious minds could identify why. That instinct, it turns out, was protecting them. If you commented right-side sleeper earlier, this section was written directly for you. The solution is coming. Keep watching. The fetal position. Knees pulled up to the chest. Shoulders rounded inward. Chin tucked toward the sternum. For many people, especially women over 60, this is a default. It feels warm. It feels protected, almost like the body is wrapping itself in a hug. Emotionally, I completely understand the appeal. It can feel like the most natural position in the world, but physiologically, 3 things go wrong simultaneously. First, your lungs are compressed. The rib cage cannot fully expand. Every breath all night is shallower than your body actually needs. Tidal volume drops. Blood oxygen saturation dips incrementally, breath by breath, hour by hour. Second, the blood vessels running through your hip joints and behind your knees, particularly the popliteal vessels, become bent and partially compressed. Circulation to and from the lower limbs is reduced. If you already have a tendency towards swollen ankles or poor circulation in your legs, this position is quietly making both worse every night. Third, your neck is flexed forward. We have already covered what that does to vertebral artery flow and jugular drainage. All of the same consequences apply here, just expressed through a whole body version of the same compression pattern. Research published in Respiratory Physiology and Neurobiology documented that sustained spinal flexion during sleep measurably reduces tidal volume. Multiply even a 10% reduction in oxygen per breath across every breath taken during an 8-hour night, and you are talking about a meaningful deficit in oxygen delivery to brain tissue that is already aging, already operating with less reserve than it had 20 years ago. If this describes how you sleep, if you curl up tonight the way you have for the past 3 decades, the adjustment does not have to be dramatic. A body pillow position between your knees and in front of your torso can open your hip angles slightly without forcing you into a position that feels foreign. Small structural shift, real physiological improvement. This is the one that brings everything together and amplifies it. And it is the most socially common mistake on this entire list. You finish dinner at 7:30, a glass of wine while watching television, in bed by 10. That sounds like a perfectly normal evening for tens of millions of adults over 60. It is the routine. It is the ritual. It feels healthy because it feels calm. But here's what is happening inside your body during those sleeping hours. After a large meal, your body reroutes significant blood volume to the digestive system. Blood is redirected away from your brain and heart toward your gut. In a younger body with elastic, responsive arteries and a fast autonomic nervous system, this redistribution is managed seamlessly. In an older body with stiffer vessels and a slower pressure regulation response, this shift can create transient drops in cerebral blood flow, moments where the brain is subtly, silently undersupplied, while you believe you are resting. Now at alcohol. Alcohol is a vasodilator. It relaxes and widens your blood vessels, which causes your blood pressure to drop. Your body senses this drop and compensates by constricting vessels and pushing pressure back up. Then the alcohol metabolizes further. The effect shifts and pressure fluctuates again. Up, down, up, down, all night long. And in vessels that are already managing some degree of age-related stiffness, plaque buildup, or reduced elasticity, that oscillation is not neutral. It is mechanical stress on arterial walls, repeated for hours during the hours when your cardiovascular system is supposed to be recovering. The American Journal of Hypertension studied this exact pattern and found that even moderate alcohol consumption within 3 hours of sleep disrupted the natural overnight blood pressure dip that healthy sleepers experience. Without that dip, without that window of reduced cardiovascular strain, the night offers no real recovery. It is just more stress in the dark without awareness. The practical recommendation: finish eating at least 3 hours before bed. If you drink, stop at least 4 to 5 hours before sleep. And add one simple habit after dinner: a 15-minute gentle walk. Not exercise, just movement. It initiates digestion, helps normalize blood sugar, and gives your cardiovascular system a chance to settle before you go horizontal. Now for the part that changes things. Position 1, left side sleeping. This is, without question, the most evidence-supported sleep position for cardiovascular and neurological health in adults over 60. When you sleep on your left side, gravity aligns with your heart's natural orientation. The inferior vena cava, the large vein we discussed, runs along the right side of your spine. Left side sleeping takes compression off that vein entirely, allowing blood to return freely and efficiently from your lower body to your heart. Your heart works less. Circulation stabilizes. Nighttime blood pressure dips as it should. But here's a discovery that has genuinely reshaped how sleep researchers think about body position. About a decade ago, scientists identified what they named the glymphatic system. Think of it as your brain's overnight sanitation department. While you sleep, cerebrospinal fluid pulses rhythmically through the spaces between your brain cells, flushing out metabolic waste, including amyloid beta and tau proteins, the same proteins found in excessive accumulation in the brains of Alzheimer's patients. A landmark study published in the Journal of Neuroscience found that glymphatic clearance is most efficient during side sleeping, and left side sleeping appears to offer slightly superior drainage geometry based on the brain's natural asymmetry and the directional flow of cerebrospinal fluid. This means left side sleeping is not just about tonight's circulation. It is about whether your brain is adequately clearing the biochemical waste products that, across decades of accumulation, become cognitive decline. If you have never been a side sleeper, start with a full-length body pillow in front of you. It prevents rolling. Add a pillow between your knees to keep your spine neutral. Give it 7 nights. Your body will adapt faster than you expect. Position 2, back sleeping with a 15-degree elevation. For those who genuinely cannot tolerate side sleeping due to shoulder arthritis, joint pain, or decades of established habit, there is a safe and effective alternative. Elevate your entire upper body between 15 and 30 degrees, not just your head on stacked pillows, which, as we covered, creates cervical compression, the entire upper torso on a gradual incline. A wedge pillow achieves this well. An adjustable bed frame achieves it even better. What does this accomplish? It uses gravity to assist blood return from your lower body. It reduces intracranial pressure pooling that flat sleeping creates. It keeps your airway more open throughout the night, improving oxygen delivery. And if you place a small pillow under your knees as well, maintaining the natural lumbar curve, you achieve what sleep researchers describe as near-zero gravity posture, pressure distributed evenly across the entire body, minimizing strain on any single vessel, joint, or nerve. This position is particularly beneficial if you experience mild sleep apnea, frequent morning headaches, swollen legs by evening, or if your blood pressure has been reported as elevated even during sleep. Position is a foundation, but your sleep environment either supports or undermines everything your position is doing. Temperature. Keep your bedroom between 65 and 68 degrees Fahrenheit. A cooler room helps your core body temperature drop, which is a biological trigger for deep, restorative sleep. It also naturally lowers nighttime heart rate and blood pressure. Too warm, and your heart rate stays elevated all night, keeping you in the shallow sleep stages where no meaningful cardiovascular recovery takes place. Light and screens. Blue light from phones and tablets after 9 p.m. suppresses melatonin production and delays your brain's entry into deep sleep. Your glymphatic system, the waste clearance mechanism we discussed, operates most actively in deep sleep. Disrupt that window, and the clearing stops. Put the phone away an hour before bed. Read something physical instead. Noise. Sounds that did not fully wake you still interrupt deep sleep through brief, invisible microarousals. Your heart rate spikes. Cortisol rises briefly. These events do not register consciously, but your vascular system registers every single one across the course of a night. A white noise machine or quality earplugs can eliminate this variable entirely at almost zero cost. One monitoring tool worth considering: an overnight pulse oximeter, a small clip-on device that tracks your blood oxygen saturation through the night. If your oxygen regularly drops below 92%, that is a conversation you need to have with your doctor. It can point to sleep apnea, early circulatory compromise, or respiratory problems that all significantly elevate stroke risk. It is the kind of data your physician will genuinely want to see. Here is what I need you to carry out of this video. Your stroke risk does not pause when you fall asleep. In many ways, the hours between midnight and dawn are the most consequential cardiovascular hours of your entire day. And the position your body rests in during those hours is something you have direct, immediate, zero-cost control over starting tonight. Pick one change. Just one. Switch to your left side. Elevate your head 15 degrees. Stop eating within 3 hours of bed. Replace 3 stacked pillows with one contoured one. Any single one of these is not a minor adjustment. It is a consistent nightly intervention that compounds across weeks, months, and years. Now drop a comment and tell me, which change are you making first? Reading your responses genuinely helps me understand what people are dealing with, and it may help someone else in this community recognize a pattern they have been quietly ignoring for years. If this gave you something that your last doctor's appointment never did, please hit like and share it with someone who needs to hear it. A spouse, a sibling, a parent, someone who keeps waking up with unexplained headaches and has been told it is just aging. And subscribe, because next week I am covering the 5 early morning symptoms that cardiologists say are far more serious than most people recognize. Symptoms that appear in the first 20 minutes after waking. Symptoms that millions of people dismiss as normal aging, but that may be your body sending a very specific, very urgent warning. You will want to see that one. Until then, sleep smart, protect your brain, take care of yourself. I will see you next week.